Hello and welcome to It's Your Case, presented by VetCT.com. I'm Lucy Meehan and I'm your radiologist on demand for this case. So the case that we've got for you today is a 3-year-old Andalusian gelding who has a clinical history of having increased digital pulses and being uncomfortable in the walk in all 4 feet, and there is clefting or a depression of both forelimb coronary bands. So the images provided are a single lateral medial projection of each forelimb. Lateral views provided a week ago are also provided for comparison. So once you've reviewed the radiographs using your systematic approach, you're ready to watch the video. So I'm going to highlight the most important findings. I'm going to use the left front foot as an example because I think this is more severely affected than the right front foot, but I think there's quite a few important learning points with this case. So if we look at the image on the right of the screen, that is the initial image from a week ago. We can see that we've got really good alignment between the dorsal hoof wall here and the dorsal border of the distal phalanx and the dorsal hoof wall, and we can see that this is slightly divergent, but only very mildly so on the image from today. So that measures out as an angle of about 4 degrees. So I'm not too, there is definite rotation of the distal phalanx, and that's one of the most obvious things you will see. The other thing that's really important in this case is actually the degree of sinking of the distal phalanx. So one of the things that we look at when we're looking at a laminitic horse is what we call the founder or the D distance. So that is the distance from the point of the coronary band, which is delineated by the metal marker, but also in this horse you can see it's a depression, and the extensor process of the distal phalanx. So I'm just drawing these 2 horizontal lines here so you can see where I'm measuring from and to. So if we just drop a vertical line down from the coronary band to the level of the extensor process, I'm just doing this very roughly, that's coming out at about 12 millimeters there. And if we do the same thing, I'm just going to guesstimate on this image, we're coming out about 5 millimeters. So that distance has definitely changed. So the distal phalanx has dropped within the hoof capsule, and that's something that's often overlooked on x-rays of laminitic horses. So that's a really important thing to look out for, because we only have a very mild degree of rotation, but we have got this very definite degree of sinking, and certainly this little notch at the coronary band here isn't present in the previous images. So if you do see that, that should be ringing alarm bells. The other things to look at with a laminitic horse is a loss of distinction of the layers of the hoof wall. So you can see just about a bright white line here and then a slightly darker area here. So that signifies the hoof horn and the lamellar tissue, and you can see we've kind of lost a bit of distinction there. This whole dorsal tissue looks thicker in this image than here, and we've also got a loosened area here which possibly represents some seroma formation or some gas trapped within the hoof capsule. So that's an important thing to be looking at as well. There is a ratio that we can measure of dorsal hoof wall thickness to distal phalanx length. In this horse that measures about 0.37. Normal is less than 0.25, so that's obviously quite abnormal in this horse as well. Moving further distally, we can see that the sole thickness is very thin, so there's only 3 millimeters of sole between the tip of the distal phalanx and the floor. We know in laminitic horses that perforation of the distal phalanx through the solar margin is a risk, so that is something to look at as well when you're suspicious a horse has laminitis, and you can see that that has changed significantly from a week ago where it was a centimetre. So all of these things are pointing towards this horse having chronic laminitis, chronic because we can see radiographic changes, and having both mild rotation and distal displacement of the distal phalanx. And these are really important things to pay attention to on laminitic radiographs. It's very easy when you're looking at a radiograph of a laminitic horse to say, oh, there's not very much rotation, it's probably okay. And actually this change in the solar depth is really quite important. I think that probably covers everything that we've got in the report. There is a couple of really nice references in the report. So there is a really nice paper by Kerry Sherlock, which talks about the radiographic and radiological assessment of laminitis, and that does explain most of these measurements. I think, you know, what we can say about this horse is that we have a chronic laminitis, we've got distal rotation, and we've got sinking of the distal phalanx. The prognosis for any horse with sinking of the distal phalanx is worse, and I would always comment on that solar thickness there as well, in order to get the message across that actually this horse is probably not in a very good way at the moment. If you have any questions, do remember it is your case, so please do feel free to ask any questions on social media. I hope you enjoyed the video, and please do ask if you've got any queries.